Side effects of steroid include. The correct option is option B, osteoporosis. The incubation period of measles is. The correct option is option B, 10 to 14 days. The normal pH range of blood is. The correct option is option B, 7.35 to 7.45. The best indicator of hydration status in a child is. The correct option is option B, urine output. The pacemaker of the heart is. The correct option is option B, SA node. Anxiety disorders are best treated with. The correct option is option C, antipsychotics. Which of the following is a sign of hypovolemic shock? The correct option is option C, cold clammy skin. The primary precaution for airborne disease is. The correct option is option C, negative pressure room. Hand hygiene using alcohol-based sanitizer should last at least. The correct option is option B, 20 seconds. The principle of do no harm is called. The correct option is option B, non-maleficence. Exclusive breastfeeding is recommended for. The correct option is option B, 6 months. The safest site for intramuscular injection in neonates is. The correct option is option C, vastus lateralis. Which is the first breast milk produced after delivery? The correct option is option B, colostrum. The primary mode of transmission for hepatitis B is. The correct option is option B, sexual contact. The sterilization method for heat-sensitive instruments is. The correct option is option B, ethylene oxide gas. The Apgar score includes all except. The correct option is option D, birth weight. The common causative organism of urinary tract infections is. The correct option is option B, Escherichia coli. Warfarin acts as an anticoagulant by inhibiting The correct option is option A, vitamin K. The causative agent of tetanus is. The correct option is option A, Clostridium tetani. The normal duration of the third stage of labor is. The correct option is option C, 5 to 10 minutes. Which is the universal blood donor type? The correct option is option C, O negative. A child with vitamin D deficiency is likely to develop. The correct option is option A, rickets. Which therapy is commonly used for depression? The correct option is option B, cognitive behavioral therapy. Which ethical principle involves telling the truth to the patient? The correct option is option B, veracity. Hemoglobin is a protein found in. The correct option is option B, red blood cells. The primary function of white blood cells is. The correct option is option C, immune defense. The nursing process includes the following steps except. The correct option is option C, litigation. On which date is International Nurses Day celebrated? The correct option is option B, May 12. Which is the largest artery in the human body? The correct option is option B, aorta. Which vitamin is synthesized by the skin in response to sunlight? The correct option is option D, vitamin D. What is the normal range for adult blood pressure? The correct option is option C, 120 and 80 mmHg. Which term describes a wound that reopens after surgery? The correct option is option B, dehiscence. The process of breaking down food in the stomach is primarily due to. The correct option is option B, hydrochloric acid. Which part of the digestive system is primarily responsible for nutrient absorption? The correct option is option B, small intestine. Which part of the brain controls involuntary action like heartbeat and breathing? The correct option is option C, medulla oblongata. Which part of the brain controls balance and coordination? The correct option is option B, cerebellum.